We will be entering the third part of the lecture. Where did I put my keys again? Techniques to improve your memory. Again, my name is Matt Heller, and I welcome you back for the third and final part, and I hope you enjoyed the first two parts. The next part, we're going to begin talking about normal forgetting versus dementia. We need to understand that most people have occasional lapses in memory that are a normal part of the aging process. It's not a warning sign of more serious mental deterioration or the onset of dementia. We are allowed some degree of memory loss that is acceptable as we get older. It may be difficult to distinguish this condition, sometimes referred to as benign forgetfulness of the elderly patient, from what really is true dementia. So we need to ask ourselves, does your memory loss affect your ability to function? When memory loss becomes so pervasive and severe that it disrupts your activities of daily life, your work, your hobbies, your social activities, and your family relationship, you may be experiencing the warning signs of Alzheimer's disease or another disorder that may cause dementia, or a condition that even mimics dementia. So what is normal age-related forgetfulness? Is the simple thing that we may forget, like forgetting where you left something, like where you left your keys, where you left your wallet. It's forgetting the names of the people who you just met 5 minutes ago. It's forgetting that you had a doctor's appointment earlier this morning. It's having trouble remembering what you just read. Again, this goes back to difficulty that develop as we get older. Like when you just read something, you need to pay more attention to what you just read and hope that you realize that you have to put more association and attention and use all your senses in order to encode it into your long-term memory. It's having trouble remembering the details of certain conversations. It's going into the kitchen and realizing that you forgot why you even entered. It's becoming very easily distracted by the outside noise. And it's unable to retrieve the information that usually is at the tip of your tongue. However, now it takes a couple of seconds for you to come up with the word that you are looking for. So, when you have normal age-related memory changes, you're still able to function independently and pursue normal activities despite the occasional memory lapse. It's being able to recall and describe incidents of forgetfulness. Most people, if you forgot your doctor's appointment, you will realize you forgot your doctor's appointment and you're able to recall that event of forgetting your doctor's appointment and working on that problem and making a solution so that you don't forget your next doctor's appointment. You may pause to remember directions, but you don't get lost in familiar places, like in your front yard or your backyard. It's having the occasional difficulty finding the right word, but no trouble holding a conversation. And your judgment and decision-making ability will always remain the same. However, that we just spoke about what would be normal age-related memory changes that you may see typically in the elderly patient. But what more severe is symptoms that may indicate dementia. It's difficulty performing the simple tasks such as paying your bills, getting dressed in the morning appropriately, washing up, or forgetting how to do the simple things that you normally were able to do in the past. And then you're unable to recall or describe a specific instance where memory loss causes a problem. Like the example I gave before with your doctor, you may forget your doctor's appointment, and then you won't even realize that you forgot your doctor's appointment, and you can't recall the incident. It's needing outside help from other people to help you with your activities of daily life. Other symptoms include getting lost or disoriented in familiar places. It's not being able to follow the simple directions. Words are frequently forgotten, misused, or even garbled. You repeat phrases over and over and over again within the same conversation. And worse, you have trouble making choices. You may show poor judgment and behave in socially inappropriate ways. So when we talk about severe memory loss, we talk about two kinds. We talk about the reversible kind, and we talk about the irreversible kind. And there's so many reversible kind of memory loss, which makes it so important that you seek help immediately from your doctor. For example, your health, your environment, and your lifestyle may contribute to your memory loss, and with the proper diagnosis, this can be reversible. For example, what's one cause of memory loss that's reversible? The side effects of medications. As we get older, we develop more medical problems, and we take more and more medication. Many prescribed and over-the-counter drugs, or even combination of drugs, can cause cognitive problems and memory loss as a side effect. This is especially common in the older adult. Why? Because they break down and absorb medicine more slowly. Common medications that affect the memory and brain functions include sleeping pills, antihistamine, blood pressure, arthritis medication, and even painkillers. Also, depression can mimic the signs of memory loss. It makes it even harder for you to concentrate. It makes it harder for you to stay organized, to remember the things and get stuff done. Depression is a common problem in older adults, especially if you're less social and active than you used to be, or you've recently experienced a number of important losses or major life changes, such as retirement. You got diagnosed with a very serious condition, the loss of a loved one, or even moving out of your lifelong home. And vitamin B12 deficiency is another reversible cause of memory loss. Vitamin B12 protects the neurons and is vital to healthy brain functioning. In fact, a lack of vitamin B12 can cause permanent damage to the brain, which is why you need to seek help early and find out if this is, in fact, your cause of memory loss. Older people have a slower nutritional absorption rate, which can make it difficult for you to get the B12 your mind and body needs. This is particularly true if you smoke or if you drink. If you address the vitamin B12 deficiency early, you can reverse your memory problem. Treatment is available in the form of a monthly injection. Some other reversible problems include thyroid problems. The thyroid gland controls your metabolism. If your metabolism is too fast, you may feel confused. If it's too slow, you can feel sluggish. You can feel depressed. Thyroid problem can cause memory problems such as forgetfulness, difficulty concentrating. Again, medication can reverse these symptoms. Alcohol abuse. Maybe not so much now, but in the past. Excessive alcohol intake is toxic to brain cells, and alcohol abuse can lead to memory loss. Over time, alcohol abuse may increase the risk of dementia. Because of this damaging effect of excessive drinking, alcohol should be limited to just 1 to 2 drinks a day. And as we get older, dehydration becomes more and more of a factor for memory loss. Older adults are more particularly susceptible to dehydration. Severe dehydration can cause confusion, drowsiness, memory loss, and other symptoms that look like dementia. It's very important that we all stay hydrated, especially during the hot summer months. Be particularly careful if you take a diuretic or even a laxative, and if you have certain medical conditions like diabetes and high blood sugar or diarrhea, in which you're losing a lot of fluid and you need to increase your fluid intake. So when we talk about the more severe form of memory loss, we talk more about dementia. Dementia is a general term for a group of brain disorders that cause memory problems and make it hard to think clearly. symptoms such as we mentioned earlier, like forgetting all sorts of things, confusing, trouble with the right language, not being able to find the right words for things, trouble concentrating or reasoning, or even paying your bills or balancing a checkbook, or getting lost in familiar places where you've been to so many times. Dementia is a progressive deterioration of intellectual function, typically characterized by preservation of consciousness. And everybody has the same risk factor. And what is that risk factor? It's increasing with age. And there is nothing that we could do about that. Dementia starts off very mild, and it gets worse very slowly. So I spoke with you about some reversible causes of dementia. Now I'm going to mention some irreversible causes of dementia. I'm going to talk about Alzheimer's because it's the most common cause of these irreversible dementias. I'll talk more in detail about it in a few moments. I'm going to talk to you about mild cognitive impairment, which causes trouble with thinking and with your memory. So when you break what is mild cognitive impairment, when you break it down, it's cognitive has to do with memory and thinking, and impairment has to do with trouble. So it's trouble with memory and thinking in the mild form. When we think about Parkinson's disease, we think about a brain disorder that affects movement. It causes trembling, stiffness, and slowness. And as it gets worse, it can lead to dementia. Korsakoff dementia is secondary to thiamine deficiency. This is especially more common within the alcoholic and can be permanent if you leave it untreated. You can also have an unresectable brain mass due to the mass effects on the brain. And then there's a various number of vascular dementias which happen when parts of the brain do not get enough blood. This can happen when blood vessels in the brain get clogged and blood clots or fatty deposit form. This form of dementia is most common among people who have had CVAs or cerebral vascular accidents or strokes, or people who are at increased risk for strokes. And that's why, again, to prevent this form of dementia, you need to make sure that you live a healthy lifestyle. And that if you have diabetes, or if you have high cholesterol, or high blood pressure, you need to continue to take all your medication and make sure that these numbers are as close to normal as possible. And you need to get follow-up lab and always make sure that your numbers are within normal or even close to normal range. So I'm going to talk about a little bit about mild cognitive impairment, and it causes trouble with memory or thinking. Now you have problems that are more significant than those of the normal aging, and it's the very least severe form of dementia. Usually, people don't have many problems doing their daily activities and tasks. The most common symptom is memory problem. However, other people may have trouble in other areas, such as concentrating, reasoning, or just remembering the correct words to use. You need to have follow-up evaluation, which become very necessary, very important, because even if some memory or thinking problems can't be treated, you need to know what daily activities you're not able to do anymore, such as drive a car, do some cooking, or even traveling or taking your medication on your own. You may need or require assistance from family members or even a home health aide. So my next form of dementia is Alzheimer's disease, which is very common and the fourth most common cause of death in the United States. Prevalence increases with the age. So about 10 to 15% of individuals over the age of 65 and 15% to 30% of individuals over the age of 80 have Alzheimer's disease. However, many will die from other causes first, such as infection, especially when the patient becomes debilitated due to their disease. So what happened in Alzheimer's disease that makes it so severe? Your brain shrinks secondary to neuronal loss. So when your brain shrinks, your ventricle will enlarge, and your memory will deteriorate with no recovery. So let's talk a little bit about the different stages of Alzheimer's disease. It begins in the early stages where you have mild forgetfulness. You have the impaired ability to learn new material, and you can develop some changes in personality. You may become more aggressive, or things may change in your life, and you may react different to those changes than what a normal person would react. Then we enter the intermediate stage, in which your memory is progressively impaired. However, most patients I've seen are very aware of this. However, many of them become in denial. Also seen is visceral spatial disturbances, which are very common, and that's getting lost in familiar places and difficulty following directions. And in this stage, you may see a guy in their front lawn, on his own front lawn, in front of the house that he lived for 20, 30 years, and he doesn't know his way back into the house. And then we enter the later stages, and at this stage is when we need help with our activities of daily life. So we can't remember the names of relatives, of friends, or what we need to do in order to get dressed and do simple activities. And then we enter the advanced disease, which is the complete debilitation and dependent on others. We develop incontinence, both urinary and bowel. And then we forget our own name. We forget who we are or where we are. And at this point, in the later stage, death usually comes secondary to infection, which is a complication of being in a debilitated state. So what makes the diagnosis of Alzheimer's disease? Basically, it's a clinical diagnosis. We need to exclude all the other causes, especially the reversible causes of dementia, which I mentioned earlier on the other slide. So you need to seek your doctor. You need to get some blood work done and see if there's any reversible causes of memory loss before we can make the diagnosis of Alzheimer's disease. Your doctor may order a CAT scan or an MRI, which will show cortical atrophy with the enlargement of the ventricle, which makes our diagnosis of Alzheimer's that much stronger. So when I spoke to you about the brain shrinking, I'm going to show you a diagram on the next slide that's going to give you an example. This is a picture of a normal brain on the left side, and a patient with Alzheimer's, their brain is on the right side. Notice on the left side, the brain is more compacted, and on the right side, it's becoming shrinking. It's losing function. It's losing mass. The ventricle is becoming enlarged. Look at the memory section. You have less brain within the memory section. You have less brain on the language side. And this is an irreversible cause of dementia. And it's most likely going to be seen when a patient gets a head CAT scan or even an MRI. So what can we do to prevent memory loss and cognitive decline? We could exercise regularly, which boosts our brain growth factors and encourage the development of new brain cells. Exercises also reduce the risk for disorders that lead to memory loss, such as diabetes, which we went over before, and coronary vascular disease. Exercise also makes a huge difference in managing stress and alleviating anxiety and depression. So all in all, exercise will lead to a healthier brain. We can stay social. People who don't have social contact with their family and friends are at higher risk for memory problems than people who have strong social ties. Social interaction helps the brain function in several ways. It often involves activities that challenge the mind, and it helps ward off stress and depression. So what you need to do to stay social, you need to join a book club. You need to reconnect with old friends, especially with Facebook nowadays. You can contact old friends that maybe you haven't spoke to in 30, 40, 50, even 60 years. You guys are all doing a part by staying social by attending these library lectures. Just being with other people will keep you sharp. Watch what you eat. Eat plenty of fruits and vegetables and drink green tea, as these foods contain antioxidants in abundance, which can keep your brain cells from rusting. Omega-3 fat rich food, such as salmon and tuna, they're particularly good for your memory loss or cognitive impairment. Eating too many calories can also increase your risk for developing memory loss. So try to avoid any food that has a lot of saturated and trans fat, which can also help your cholesterol level and reduce your risk of stroke. As I mentioned earlier, with the vascular dementia, if you reduce your risk of stroke, you can delay any further damage to your brain and to your memory. We spoke about earlier about managing your stress. Cortisol, the stress hormone, damages the brain over time and can lead to memory problems. But even before that happens, stress causes memory difficulties in the moment. When you're stressed out, you're more likely to suffer memory lapses and have trouble learning and concentrating. Remember what I mentioned earlier? That your short-term memory, you can only fit 5 to 7 pieces of information within your short-term memory in order for that to be transferred to your long-term memory. So 5 to 7 pieces of information isn't a lot. And when you have anxiety and you're stressed out, those thoughts and those feelings are going to take over your short-term memory. You need to get plenty of sleep. Sleep is necessary for memory consolidation, the process of forming and storing new memories so that you can retrieve them at a later date. Sleep deprivation also reduces the growth of new neurons in the hippocampus part of the brain and causes problems with memory concentration and decision making. It can even lead to depression. So make sure that you get you a good night's sleep every night. And most importantly, evidence will show you everywhere. Don't smoke. Smoking heightens the risk of vascular disease and can further enhance dementia. It can lead to stroke and constrict arteries that deliver the vital oxygen that is needed for your brain in order for you to remember. So walking, like I mentioned earlier, is a form of exercise that basically is an easy way to fight memory loss. This picture I got from the New York Times, which was released in 2007, in reference to the American Academy of Neurology, which reported that walking 6 to 9 miles every week can prevent brain shrinkage and memory loss. So older adults who walked between 6 to 9 miles per week, they had more gray matter in their brain 9 years after the beginning of the study than people who lived sedentary lifestyles. For people over the age of 65, regular walking appears to have a 40% reduction in risk, which is a pretty decent number. Walking helps because it staves off dementia. It increases your blood flow to your brain and lowers the risk for vascular disease, such as diabetes. The neurology study didn't show a connection between exercise and Alzheimer's per se, but the authors noted that other studies have shown a benefit. So more research needs to be done before ruling out exercise as a way to lower risk for Alzheimer's. However, that's not to say that we shouldn't exercise, because exercise helps us, like I mentioned before, in so many other ways, and improves our mood and decreases our risk for vascular disease. So the question always becomes, When do we need to see a doctor for memory loss? When memory lapses become so frequently and it becomes very noticeable and a concern for you or your family member, you should seek your doctor early. Your primary care physician will perform a thorough history and physical exam. Your doctor is going to ask you a lot of questions about your memory, including how long have you or others noticed you've been having a problem with your memory. What kind of things have been difficult to remember? Have the difficulty become gradually or suddenly? Or whether you're having trouble doing the ordinary things. They're going to review all your medication. They're going to review your eating habit, your sleeping habit. These are all topics that we spoke about earlier, and they can all affect your memory. And many of these conditions can be reversible. They're going to get your partner involved, and they're going to keep track for a few months on the progression of the memory loss. So what kind of further evaluation are you going to need for memory function? If required, they may send you to a neuropsychologist for a pencil and paper test that tests different aspects and mental ability. They're gonna give you 3 objects. They're gonna take that 3 objects away from you, and they're gonna ask you to recall what those 3 objects were. They're gonna rule out other causes of memory loss. They may decide to do some imaging of the brain, such as a CAT scan or even an MRI, which can detect anything putting pressure on the brain. And if that's normal, they could do a PET scan or even a PET scan which tracks the blood flow and metabolic activity in the brain. So we're coming up to the end of the lecture, and just to summarize real quick, normal forgetting is normal as we get older. Only when it becomes affecting your activities of daily life, making it harder for you to remember the simple things that you could normally remember, you need to seek medical help to identify the reversible causes of dementia. Many of these reversible causes are very easily treated, like depression. You could be treating with counseling, antidepressant. Your thyroid, if you have a low thyroid, we could give you supplement and additional thyroid medication. Your B12, if you have B12 deficiency, we can give you a monthly injection of B12. You need to enjoy your social activities. You need to keep your brain happy. And don't forget, we are all in this together as far as memory loss. So thank you to Babylon Library for bringing me here today. And for those of you who were not able to attend the lecture, or obviously you all attended this lecture today, but those who have friends that were put on a waiting list because they couldn't get in and this was by high demand, I posted this lecture on YouTube. So search for it, and I look forward to seeing you guys soon. Thank you for your attention.